Hi, this is Dr. Wright and certified lymphedema therapist, Jen, and we're talking about compression today, the benefits of compression. Everybody knows compression moves fluid, and that's what they think of it, helps with swelling. And everybody knows you're supposed to wear this for lymphedema, lipedema, vein trouble, and it helps move fluid and venous blood back towards the heart and towards the lymph nodes. So there are some other benefits that are for compression that aren't really widely talked about. And in lipedema and lymphedema, there's lobules, and compression helps smooth lobules, and so therefore it helps mobility, keeps thighs and knees from rubbing together, helps prevent cuffs and that sort of thing. It helps with pain. Compression has an anti-inflammatory properties, and so everything it shows that there's less inflammation. That'll mean that can help possibly slow down the progression of things, and compression is helpful for all types of edema that have been studied. And compression helps maintain the benefits after surgery. So every treatment we have for lipedema and lymphedema are based on compression, and so MLD, which is very helpful, and pumps, those are very helpful, but to maintain the benefits of those pumps and MLD, you need to wear compression. And it's critical after surgery to help reset the skin memory and help the skin go to a new space. And then no talk of compression is complete without understanding kind of the how it works, and it works by graduation. So there's gradually decreasing levels of compression strength. So the highest compression is at the most distal, around the ankle or the wrist if it's on an arm, and then it gradually, the level of compression strength decreases, and so going up that gradient is the lymph and the venous blood, and that's how it works. Now but Jen's we're gonna start talking more about like different types of compression and how to use it.
Okay, so a lot of times when you say, okay, we need you to get some compression, the first thing that the patients do is go, oh. So I don't want you to, like, he just went over all the benefits with you. But I mean, most people think of that double knit, brown, their grandma's hose compression. And there's many, many different types, styles, colors, fabrics. So you really just need to work with figuring out what works for you and what is comfortable for you. One of the most popular, I'm going to say probably, that kind of shows it on her.
Yeah, so
that's a capri. So it used to be that all that was available was pantyhose, and those were pretty awful. But so this is a capri, and you can't see it because it's black, and I'm black. There we go. That's a little better. But then what you would want to put on with this would be a stocking. And again, stockings. So you'd kind of, again, with his gradient pressure, so you've kind of layered that there, if you will. And stockings come in different colors. They come in fun. They come in tie-dye. They come in, if you need them to match like your slacks, if you need like khaki or blue. So you can have all kinds of different shapes, sizes, colors. Then this would be more of a thigh high.
Yeah. But
they can actually come pretty sheer. So people aren't even going to know you're wearing compression if you wore this. So this is actually a thigh high, but you'll see once I pull it out a little bit and it gets up to that thigh, it's see-through, almost like you were wearing pantyhose. So like if you were wearing a skirt or something, nobody would even know that you were wearing a thigh high or compression. So I don't want you to be scared of compression. A lot of my patients will report that once they start wearing their compression, they feel so much better. Their legs feel less heavy and less tired through the day. So think of compression as your friend, not your enemy.
Great example. And you know, it really is, it's so important as we went through, and it really has so many benefits. And you know, I think that you have to you have to try different things, because I mean, sometimes it is a trial and error thing, but
and if your doctor has prescribed therapy for you, it is okay to wait until you go to the therapist and let her or him help you measure and maybe give you some recommendations about what they think would be good for you, because compression is expensive. So you do want to I mean, it's not like you can go out there and buy 10 different ones, but you'll want to find what works for you. And a lot of times the therapist will have lots of good recommendations. So if you are going to therapy, that would be a way. There's also, when you go to the medical goods stores, that oftentimes the doctor that prescribed this for you could help you find in your area. They will specifically measure you too, because it is important to get the right fit.
Yeah, and also there's some great places online, Bright Life and Compression Guru, and you can, and
they'll show you where to measure as long as you feel comfortable doing the measurements yourself.
So we just want to encourage everybody to find the right compression for them, and start your legs looking and feeling better.
Energizing them.